outside the Battlefield Mall.
Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin. Get the health answers you need from the creator of holistic medicine and the 2020 Holistic Doctor of the Year. To be a part of the show, call 417-447-1777. Wellness Wednesday. Now, here are your hosts, Dr. Norm Shealy and Dr. Shealy-Sorin.
Third-party rape. If you know what that is, well, we'll discuss it in detail. In the meantime, however, think about your overall health. And there are two things that I have a strong recommendation for. And probably at the top of that list is Nature Blessed Tart Cherry Juice Concentrate. The average American gets 2.2 servings of fruits and vegetables a day. You need 8 to 10. But you can get 3.75 out of 2 tablespoons of Nature Blessed Tart Juice Concentrate, available in the produce department at real grocery stores. It's so good, I take 4 tablespoons every day, and it's so safe. It can't possibly harm you. And it'll please your taste buds if nothing else, and your overall nutrition will be much better. And of course, we'll be talking about this in some greater detail later on, but everybody needs supplements in today's polluted world. And at the top of my list of places to get your supplements is Spring Valley Natural Foods, right there on Glenstone, just a block north of Sunshine. The reason I like Spring Valley is service. You walk into this place that has probably 10,000 things on the shelves, and they come to help you. They serve you. I mean, I couldn't find what I wanted in that store if I wanted to, but they do it for me. And of course, they carry all of our goodies, the Shealy-Sorin products like our Youth Formula, our Echo Green Essentials, our 5 Bliss Oils, our Magnesium Lotion, but more importantly, they've got what you want, Spring Valley Natural Foods. So,
yes,
sorry.
Today's topic is actually quite close to heart. Well, we're both docs, but we've both been patients, and we know plenty of patients who have been through the system. So I want to talk about a book that came out. When was it published?
1995.
1995, and the title of the book is?
Third-Party Rape. And what is the third party? Well, it's everybody except you
Yes.
who gets involved in your medical care and expenses.
Mm-hmm.
And, I've thought this since the beginning of Medicare. Once upon a time, when I was growing up, there was no medical insurance. My father just paid for what, I had tonsillectomy, I had a fractured right knee, all kinds of things like that, but he paid for it. And then in 1993, roughly, Johnson was trying to push Medicare in. And I wrote a letter to Johnson. I was on the faculty at Western Reserve Medical School. On my home station, I wrote a letter. I said, you're going to bankrupt the country. The government can't do anything that's economically sound. A week later, I got a call from the chairman of the Department of Surgery. Norm, what the hell did you say to President Johnson? I've been on the phone all day with the FBI. They want me to fire you. They say you're a communist. Well, they tried for a full week to get me fired from Western Reserve Medical School, and they failed. But they got Medicare in. Medicare came in 1965. Medical expenses were 4%. By 1970, 5 years later, they were 12%. And today, they're over 20%. Mm-hmm. And it's all because the government stuck its, I can't say what I really want to say about the government. Mm-hmm. They're the top of the heap of people who make things wrong. But, so when Blue Cross Blue Shield came in, they did odd things. Like the first policies, you had to be in the hospital to cover your insurance. They didn't cover any outpatient stuff at all. And I actually, in the early 90s, I think it was, sued Blue Cross Blue Shield of Missouri for not paying for things that were covered under Medicare. Mm-hmm. I won my lawsuit, by the way, for $300,000 against Blue Cross Blue Shield of Missouri.
Wonderful.
And interestingly, 1 year later, the president of Blue Cross Blue Shield of Missouri was sent to jail for fraud of some kind. I never had found out what it doesn't matter to me. It was justice, in my opinion. So the third party is largely your insurance mafia, and that's what I think of. They all suck, and I'm being as kind as I can on the radio. But then the legal system gets involved.
Yes.
And of course, the medical profession has actually acted as a slave to the third party, the medical insurance company. And the hospitals are the top of the log as being evil, in my opinion.
I'll give a couple of personal examples. So I've had a history of colon cancer. So ever since the age of 30s, I've had to go on, I've undergone some colonoscopies, and it's been fine since then. One thing, and there's a pattern that I discovered. This is an interesting pattern, and I'll talk about how this fits into everything, as a matter of fact. So the cost for the colonoscopy at the time, I was back in New York. This is before I joined you about 6 years ago, which is wonderful to have joined you. It cost me $1,000 for an outpatient procedure. A year later, or actually, no, it was not a year. Some years later, when I had to repeat the colonoscopy routine, and then that's why I stopped. They moved everything inside the hospital. I asked what the price was, $5,000.
Yeah.
I asked, what is the difference between the procedure now and then? I asked the doctor, are they using golden scopes? Is there diamonds on there? I don't know. I asked, what's going on?
That's the tip of third party rape.
That's right.
Once the hospital gets involved, it doesn't double the price. It runs it up by 5 to 10 times or more.
And I can give a lot more examples, including my recent surgery and how the bill tripled in over a month without explanation at the time. But I just want to say, this is how this works. And if you don't have insurance, it's important to listen. If you have crappy insurance, it's important to listen. Or if you simply want to be aware of what happens in the conventional medical system, or you've seen some concerning things, this is the right radio show segment for you. What happens is, and it is indeed a very interesting collaboration, because let's say a Tylenol costs, how much is a Tylenol? Let's say if you take one little pill.
I don't know, maybe 10 cents or 20 cents.
Maybe. Now, if you're in the hospital, a Tylenol, I looked at my bill, is about $7 to $10. Now, I hope I'm looking at the right code, but somewhere there. Now, how does it get up there that way? Now, and I am a self-pay. I've been a self-pay with this. So the people who get that's not the right word I can use on the radio. The people who get taken advantage of, that's a little more appropriate, are the people who are not under the so-called insurance. And the insurance, it reminds me, I've read a book recently about Louis Ferrante. He was involved in the mafia of all sorts, and he wrote a wonderful memoirs about how the mafia works and how everyday business can learn from the organized crime. And I think they learned very well, because what happens is there's something called a racket or protection service. In other words, a certain party protects a certain business from other bad people, of course, whom they interact with. And those bad people, basically, if you don't pay the protection, you'll get your business annihilated, or your knees broken, or something of that nature. But if you pay the protection, which is an outrageous sum, then they won't break your kneecaps. So what happens is, let's say a Tylenol costs 10 cents. Now, under the insurance, the Tylenol is going to cost you $10. I'll just give an example. Insurance is going to negotiate back down to $5 or $3. And so everybody wins, right? Except for whom? Person, client, patient. And that's how that works. So is it fair? Well, does the word fair still apply to our world?
In today's world, I don't think the word even exists anymore.
Maybe not.
Well, can't everybody be perfect, but you could try. And in my opinion, the insurance mafia began the problem of making it worse. The government then jumped in and made it 10 times worse. For instance, I paid into my Social Security many, many, many years. I get it. They take out a huge amount of money every year for Medicare, about $3,000 or $4,000. And in order to have, quote, supplemental insurance, it was costing me $4,000 a year. I gave it up this year because I'm not willing to do most things in medicine anyway. I mean, I can't imagine 90% of things that I would allow. Therefore, I'm not going to worry about I'd rather pay the 20% difference myself than pay the insurance money.
Interestingly enough, the amount you're paying, a lot of people are going to be listening saying that's nothing compared to what I pay.
Oh, I know, because if
uh,
you pre-Medicare, it would have been 4 times what 5 times at least what my insurance would have been.
Exactly.
So that part of it for the individual, at least it costs you less money. But if you don't have supplemental insurance, it still costs you an arm and a leg.
You know, it's interesting. We got a little time to talk about it, and I want to talk about this actually. This is a very big topic. Now, let's say you have a great insurance. You have the best insurance in the world. It covers everything. You're paying a reasonable amount, whatever is reasonable. What do you get from a conventional system? The good, the bad, and the ugly.
Well, acute medicine is pretty good.
Yes.
I have to say, if you have an automobile accident, you fall and hurt yourself, you have an acute infection, that is the time when medicine is at its best.
Yes.
As good as it's going to get, probably.
Mm-hmm.
And it's pretty good. But the interesting thing about it is, if it's not well, I'm talking about well, within 3 months, then it's not going to be under conventional medicine. Chronic medicine sucks. That's the kindest thing I can say about it. There is no drug or illness in the world which I would allow in this body with any chronic disease whatsoever. I don't mind dying. I just don't want to be tortured to death. I don't want to be poisoned to death. The incidence of brain damage, just brain damage alone, from antihypertensive drugs, that's one of the worst. Taking 3 antihypertensive drugs, you have a 45% chance of controlling your blood pressure. That means you have a 55% chance it won't control your blood pressure.
Yes.
And you have a 100% chance it's going to have its so-called side effects. What's the number one side effect of antihypertensive drugs? Fatigue.
Erectile dysfunction.
Well, that's for men.
Yeah.
But they don't have any energy anyway.
Right.
But it's gone. I have weaned hundreds of people off 3 and more antihypertensive drugs safely, securely, infinitely less expensive, and infinitely safer. So at the top of my list of stupidity in conventional medicine is antihypertensive drugs. The second group of drugs that sucks up the gazoo is mood drugs, anti-anxiety drugs, and antidepressant drugs. There are 4 major articles, one published in the so-called best journal in this country, the New England Journal of Medicine, that say if all the negative studies had been allowed to be published, the net result would be 0. In other words, 75% of negative studies the pharmacomafia will allow to be published. That is criminal behavior. That means there ain't a safe drug in the world. And the real problem is every drug has those kinds of complications. It damages your brain, it damages your body, it damages your immune system. It sucks. Even 65 years ago in medical school, I was taught at that time 16,000 people a year died from taking aspirin. It's still right up there with many more than that, probably over 25,000, 30,000 now. And in the so-called NSAID drugs, all of them can kill you.
But
you bleed from the gut. But if you don't bleed from the gut, it can irritate your gut and you get collagenous or lymphocytic colitis, which is a lifelong serious problem.
And by the way, I'm just going to mention a couple of things. This is how the progression of chronic care goes. Because I was trained in family medicine. I refuse to do classic family medicine the way it was taught to me, I should say. Because maybe somebody else had a different experience, better experience, I hope. Basically, let's say a person comes into me with upset stomach, uncontrolled stress, which is behind everything. So instead of learning how to deal with the stress, which is behind everything, is a root cause, and getting a person into a better place, balanced and everything else that's good, what do? You give them a mood drug, which has certain side effects, and you give them, I'll just paint you a picture, and you give them a stomach blocker for the rest of their life.
And that increases your risk of dying of infection.
Well, that's one thing. The other thing is now you can't absorb protein, and now you can absorb fat. Now you can't make use of the essential nutrients, macros, that make what your body needs.
Yeah, the hydrochloric acid blockers are a dangerous drug to your life.
And
Don't
then,
take them.
yep. No, the person, I'm just going to paint a picture here. This is very typical. It's a pattern. And then I'm really excited about this. I mean, to just be able to share this. And then you have this person who is still anxious, depressed, and all of those things. And now this dysautonomia or dysregulation of the autonomic nervous system, sympathetic, parasympathetic, has resulted in a blood pressure, cholesterol, because with a single episode of stress, you will do more in terms of the cholesterol and triglycerides, as well as the blood pressure and sugar and everything else under the sun. I can think of every single marker, biological, and all related by biochemistry and neurochemistry. We can go into a long conversation about that. Exciting conversation for me, by the way. But most people just the bottom line is now you have this person with 10 different chronic illnesses all of a sudden, and now not able to function, not able to balance, and not able to take care of themselves. And now they're a slave to the system for life.
Well, that's why holistic medicine came about.
Yeah.
In May of 1978, I founded the American Holistic Medical Association as an alternative to third-party rape, essentially. I was already quite aware of this from my work as a neurosurgeon. Now, I actually love neurosurgery. It was a fun, enjoyable thing to do. One of my last patients that I ever operated on came in coma. He had an aneurysm in the right middle cerebral artery. I operated on, took out the clot, clipped the aneurysm. And the next morning, when I walked in, he was walking down the hall to meet me. I've had scores of cases like that, brain tumors in children, cured overnight, etc. In fact, I got a phone call from such a young man I operated on when he was 12 years old. His parents would not allow blood. And I said, okay, well, stop the operation if I have to use blood. I got him through the operation, took out his cerebellar tumor without blood. 20 years later, he called me to thank me.
Wonderful.
So wonderful. I really did enjoy the neurosurgical part of it, but the system, I don't enjoy. I've never enjoyed the system. The bureaucracy and the insurance mafia all make it, well, hard to work, period.
It's really impossible. And I just want to say that if the conventional system were to be the primary default mechanism by which people get their health care, so to speak, we're missing the point. We're missing the point of thousands upon thousands of years of history of humans treating the body. Let me start with spirit. We are spiritual beings having a mental and emotional, but also physical components. And without treating that whole person, and by the way, about 300 to 400 years ago, the spirit just departed from medicine. It was surgically removed.
Because it was demanded that they remove the soul, if you will.
That's right.
And God from medicine.
Yes.
Oh, well, can't all be perfect at best, but you can try. So the important thing is you are responsible for your health. I'm not. I can advise you. I can tell you what to do, but I can't do it for you. I eat for you. I can't eat for you. I can't sleep for you. But I can tell you what you need to do. And the important thing is you need to do 5 essential things.
Yes.
And at the top of that list is you need to keep your body mass index between 18 and 24. By the time it gets to 30, you already have the life expectancy of someone who smokes 3 packs of cigarettes a day. You shortened your life by 18 or more years. And you're over to every known disease. The number one cause of early death today is obesity. And 72% of Americans are overweight, and 36% of them are just obese. But even when you're just over, like a 25 or 26 body mass index, you're already shortening your life expectancy. The second thing is the average American eats 2.2 servings of fruits and vegetables a day. You need 8 to 10. It's insanity. I mean, we weren't meant to eat sawdust. You might as well be eating sawdust if you go to McDonald's. I mean, my favorite statement, I went to McDonald's in 1962. I took one bite and spit it out, never been back. I don't buy anything off the center aisles in the grocery stores.
Absolutely.
That's 80% of the food sold in this country is junk. Third, of course, is still 22% of Americans still smoke. It's still the number 2 contributor to early death. And, of course, exercise. At this point in time, 90% of Americans do not get any conventional exercise. That means they have life expectancy of someone who smokes only 1 or 2 packs of cigarettes. It shortens your life by 5-10 years.
And the human body is meant to move.
And if you don't get 30 minutes of exercise 5 days a week, you're going to die early and have disease going there.
Exactly.
And finally, sleeping.
Yeah.
7 or 8 hours every night, not occasionally. Mood suits you because you need it. People who sleep 6 hours or less cause more automobile accidents than all alcoholics and drug addicts combined because they don't function well. You can't afford the luxury of not getting 7 or 8 hours of sleep a night. It's absolutely essential. Now, if you do all of those things, those simple 5 things, then you have a normal life expectancy of 100 years.
Mm-hmm.
But if you don't do them, you have the American average life expectancy of 79 years.
There's another, I would call it a habit or essential, as essential as anything else, probably maybe more essential, stress.
Well, stress is...
And stress management or lack of stress management.
That's the problem.
That's right.
And we've known that for well over 100 years. Sir William Osler wrote an article on this about 1908.
Mm-hmm.
And, of course, Cellier's work was monumental.
That's 30s and 40s, but
yes.
Good stuff. Yeah.
But interestingly, since 1912, we've known how to do stress. It's a simple thing called autogenic training. If you're willing to do it, roughly 36 minutes a day for 3 months. After that, you can get by with 1 or 2 minutes a day.
Once you're trained, once you have it inside
train
your
the brain.
Yeah.
It is the best, most studying in the history of the world. There are 28,000 scientific references on the benefits and safety of autogenic training. Mm-hmm. And of course, it's so important that in 1974, I went back to get a PhD studying this whole concept of self-regulation, self-control. And out of that came biogenics, and now there's 68 different variations of this wonderful technique called autogenic training, and now we call it biogenics, the life.
And there's actually an online course, biogenicscourse.com.
Yes. We get all kinds of good comments from people on that.
The one interesting thing about this entire 1920 events is that since we have not been able to be in public, because we used to give presentations 5 or 6 times a year out in conferences, so and teaching, of course. The interesting thing is we actually converted everything to online, and it actually worked out in the right capacity in this way. It's available.
Well, Aptosis is better than no break at all.
I still prefer it to be.
A consultation with us on the phone, on Zoom, or even by email, but we can't do a in-depth consultation by email. We can do it on the phone or by Zoom.
Yeah.
And at least get you started on the holistic path to whole health.
Exactly. Now, there's a few other components. And so let's talk about general health. And we're not talking about a specific, we're going to go to a break in 1 minute. I'm just going to mention briefly some basic supplements in our crazy polluted world. A good B complex or essentials. A good vitamin C plus other things that raise the DHEA, MSM, or youth formula. And those are that's the basic key. And then vitamin D3 and magnesium.
All of these are absolutely critical in today's polluted world. And we'll be continuing this right after the break.
Yes.
But folks, what is you can be healthy? And we're here to help you get there.
Yes.
We're still on our Facebook Live for the break. However, our internet connection is a little rough today, so it's a little bit choppy on the Facebook. So we've had some people interacting, but it's been a little limited today.
Well, let's see what we got.
Well, it's life, so
yeah.
Should we just keep talking if there are no questions?
Well, there's still a few topics to address. Anything that is a question or suggestion or?
We do have one question, and I think this may be a question from somebody that asked this last week as well, but they were looking for some clarification. What are the benefits of using, I suppose, what are the differences between using the magnesium lotion and magnesium spray?
Well, there's no real difference as far as working. Well, the difference is between oral magnesium. I invented magnesium lotion over 20 years ago because oral magnesium, well, you're wasting your money and time. The only thing oral magnesium is good for, if you take enough of it, it's a good laxative.
Yeah.
But if there's any fat, protein, or calcium in the gut at the same time, you can't absorb magnesium. 80% of Americans are deficient in magnesium, which is involved in 350 or more enzymes and other activities in the body. It is one of the most essential elements in the world, and it is best absorbed through the skin. If you don't like the lotion, use the spray. But if it's not the Shealy-Sorin magnesium lotion or spray, I can't trust it.
And it's got and the brand that you just mentioned, the Shealy-Sorin brand. Actually, what I love about research is that it raises DHEA as well.
That's it
that's
lowers
another
your
one.
blood pressure. It helps
Yes.
calm you down. It helps you sleep. It has many, many, many different benefits. But
Yeah.
the anti-stress hormone, raising your DHEA, is a big one.
Huge. Yeah, absolutely.
So it's important to, I think, virtually 100%. I saw a woman this morning who desperately needs magnesium lotion. Her blood pressure was only sitting in my office, only 150/90.
That's not terrible by
But
most
she has
people.
5 other
but it's high.
symptoms
Yeah.
that suggest to me she needs magnesium
Yes.
as well. And I personally found it in my own body. I used to play racquetball 5 days a week. I had a lot of generalized muscle pain. I was deficient in magnesium. The minute I began using magnesium lotion, I got rid of my muscle pain from everything. It also is absolutely essential in auricular fibrillation.
Mm-hmm.
One of my old secretaries from 40 years ago just was diagnosed with AFib, and they didn't treat it properly.
Mm-hmm.
Didn't even think about looking at her magnesium level.
Gotcha.
And so it is controllable a great deal of the time with actually magnesium lotion. And, of course, in an acute situation, intravenous magnesium can work.
Yes, absolutely. Yeah.
But you can't get it intravenous by taking it orally.
No, that requires an IV, and we do that, by the way. We do IVs in our place.
And the reason is, by the way,
Yeah.
our soil is deficient.
Mm-hmm.
So blame the farmers for that. They raped the soil, and they didn't replace the magnesium. Now, cattle farmers know they must give their cattle extra magnesium. Now, cattle can take extra magnesium. They got a second stomach, but we don't have a second stomach, and we can't absorb it through our gut. But interestingly, the vegetable and fruit farmers don't feed their plants magnesium, which is among the greatest stupidities in the world.
Mm-hmm.
If you know that you need it in your cattle, why don't you need it in everything else?
It seems to me, and I don't want to. I want to be very careful what I say lately because everybody's getting canceled. By saying a single word here and there, but it's all every industry is compromised.
Well, every industry has been compromised, and that is, of course, starts at the government at the top.
Yes.
And the framers of the Constitution were brilliant, brilliant people, but unfortunately, the government had tried to undo all their good work for the last 300 years.
And I think that's enough said on that topic. But I love it, and I fully agree.
But the important
yes.
thing is, you must read and listen and seek for yourself answers to these kinds of questions. Now, interestingly, believe it or not, I had a nurse today who came and wanted an exemption from the vaccine poison. And I'm willing to give it to her because she has severe inflammatory thyroiditis. And there are 47 different publications that show you how bad that is if you've got to take the vaccine, if you've got inflammatory thyroid.
And we're coming back.
Folks,
Now, back to Wellness Wednesday with Dr. Norm Shealy and Dr. Shealy-Sorin.
Thank you.
Okay, we are back with you, and the time has come to answer your questions here. You don't have to see us at the clinic or talk to us at the clinic or Zoom us at the clinic. You can do it every Wednesday right here from 4:30 until 5 o'clock Central Time. You can call 417-447-1777 and get our opinion right now, live. So give us a call, and we'll be happy to answer your questions right now.
And I do want to say, if a question is more personal, and everyone is different. Even identical twins have different physiologies and things that have happened to them, different mental states at different times. If there's an interest in the personal consultation into wellness, then beyond what the general concepts are, which what we can do on the radio and for education, I think it's best to make an appointment with a real holistic doc, and you can find us at specifically realholisticdoc.com. That was actually
Or
the intention.
417-351-5221. 417-351-5221. And good afternoon. You're on the air.
Hi, I'm Charlie.
Hi.
Dr. Shealy. I'm caregiver for my wife with Alzheimer's.
Okay.
And I've been taking care of her for years. In fact, years ago, I had her out to see you. But I have a problem with her eyes. Now, she's had allergy problems for years, and back when she was still aware of what was going on somewhat, sometimes she would tell me her eyes hurt, and she would actually pull little stringy stuff out of her eyes. We used eye drops and stuff to kind of manage that. But now she's in bed all the time. I haven't had her out of bed for months, but I have to wash her eyes real often. She gets a mat in there, and it'll almost mat her eyes together. It gets in the eyelashes and stuff.
Mm-hmm.
And I've been washing it with, I use warm water with baby shampoo and try to wash it with warm water and stuff. But it's starting to irritate her eyes where I guess I'm washing it so much and everything. I'm just looking for some help as to what I can put in her eyes to maybe help that.
I would try USP, United States Pharmacopoeia castor oil, and I would put 1 drop into each eye at least twice a day.
Mm-hmm.
It's very safe. It will help.
Now, what is it again? What is it again?
Castor oil. But it must get it at a drugstore. Get the USP. And you get a sterile dropper from the pharmacy and just use that in the bottle. 1 drop in each eye twice. Could do 3 times a day if you need it to keep your eyes looking better. But I would definitely try that.
Okay. Is it washing her eyes, is baby shampoo and warm water about as good as I can do?
I don't know about the baby shampoo. I wouldn't do it.
One other thing that I would certainly explore is if there's possible to, well, it may be difficult to get her to an appointment outside, but if it's possible, there are, disorders or issues that can be easily fixed by a certain instrumentation or procedure by the eye doctor, especially if there's a blocked tear duct or something of that nature. But that would require a specialist, and hopefully, you'll be able to get her there. But if it's difficult, certainly a telephone consultation. Castor oil is a fantastic idea to start off. Yeah.
Okay.
Mm-hmm.
Yeah, it's impossible. I haven't had her out of the house for months because I haven't had her out of bed for months, actually.
Understood.
Her mobility's gone. I can't get her anywhere, and she has no response much to anything.
Yeah, that'll be difficult. Yeah. So let's, do the best you can with that, and then let's get in touch.
Okay, thank you.
Thanks for calling.
Mm-hmm.
And now is your turn. 417-447-1777. Now is the time. Free consultation right here at KICK.
By the way, I want to mention something very, very important that we haven't gotten to in the first half of the discussion or before the break. The body is actually primarily electromagnetic, including cells, nerve cells, all sorts of cells. And it takes electromagnetic type of forces, and that's such as sodium, potassium pump on the cell. So I'm not, we're not talking basically New Age science, or New Age type concepts. Well, I like New Age concepts. We're talking actual science, and we'll get back to that.
Good afternoon. You're on the air.
Hi, doctors. I have a few questions.
Mm-hmm.
The first one is my sister-in-law. I'm calling for her. She recently had, it's called BPPV, benign paroxysmal positional vertigo.
Benign positional vertigo, yep.
Yeah.
Mm-hmm.
Yep. And I wanted to know what she could do, because she's concerned it might happen again, and it was really quite painful.
Mm-hmm.
And how do they treat it?
I think she said they put her in positional chair, and she had to do some things. And I don't know if they gave her medicine also. They might have.
Okay, I know what I would do, of course. Gamma P EMF.
That's
Anytime that the nervous system is going astray, the gamma P EMF is safe if you don't have a pacemaker, and it's definitely worth trying. Now, it could take, since we don't know at all, but if somebody's had that kind of problem, I would definitely use the gamma pen for minimum of a couple hours a day.
Yeah, that's a wonderful suggestion. It just stabilizes the brain and stabilizes the nervous system there. That's
and it's safe.
What causes it?
Well, we don't know.
Well,
the answer is stress of some kind.
The way what I learned about it is that there's an underlying reasons behind even behind what I'm going to say, but on a more surface, I suppose there is a factor of the middle ear and inner ear can certainly be off balance. There's little stones that basically are supposed to be falling into place to tell us where the balance is, like in every direction. And there's and if they're not in the right place, that's why you do the postural head movements, and it's an unpleasant procedure. But once it's done, hopefully it works. There are medications, but I think PEMF is definitely one of the best suggestions that I agree with Dr. Shealy on that as well, fully.
Okay. Okay. Another question is about a friend who just had cellulitis on her leg, and she had oral antibiotics for probably 10 days. It didn't get better. They put her in the hospital. She had IV antibiotics, and now she's out and she has oral again. And so what should she do after having all of that?
She should find a holistic physician and get intravenous vitamin C in large doses.
Yep. Is she local in Springfield, or at least close by?
No, she isn't.
Then
on the East Coast.
East Coast. I'm sure there's got to be a holistic person, doc, provider on the East Coast.
Only a holistic provider will provide her that, but that's what she needs.
Yeah. Should she be taking a lot of probiotics and stuff after all the antibiotics?
Oh, yeah, of course. Huge doses for the rest of her life, probably, but it's less for the next 6 months.
Okay. Then I have a question, and I'm sure you've said it before, but I don't get to catch the show all the time. I haven't had the vaccine, and now with the Delta variant, I am a little nervous. And what can I do to prevent getting?
How much do you weigh?
About 160 pounds.
You need 50,000 units of vitamin D3 once a week for the rest of your life.
Yeah, I do that.
If you ever feel the bug coming on, take 150,000 units 3 days in a row. Then you go back to once a week. And take a minimum of 2,000 milligrams of vitamin C every day.
Well, the combination of the youth
vitamin
formula.
The youth formula would be better because you get, with the MSM, you get twice as good an effect. And, of course, take B complex at least 25 milligrams a day. That would be from our essentials.
And the other thing is, the key to your question is focus on your own internal optimized immune system. And if it's not optimized through the basic lifestyle, we talked about that a little bit, supplements, basic supplements, but also stress management. Stress and immune system are
autogenic training.
Autogenic training, directly connected, absolutely directly connected.
Okay, because I do take all those supplements, but I'm almost 68, and I know everyone around me has the vaccine, and it's just I do get a little nervous sometimes. Like, should I get it, or I just.
Well, I'm 88 years of age, and I haven't had it, and I will not. So that tells you my thoughts about it.
Right. And then my last question. I'm sorry if you're taking so much time. It's about a holistic doctor. Now, I live in Massachusetts, and I Googled, find a holistic doctor near me, but I really didn't come up with anything. I didn't know if there was a registry.
I would say a real holistic physician is pretty much hard to find. I know that we do telephone and Skype consults, so if there's nobody local in your area that you like and trust, it's good to be local if you can, but it's also possible and very a lot of our consultations are telephone and Skype,
And Zoom.
and Zoom. So you can always get in touch with us. Now, of course, if we need to be seen in person, we do have people flying in from actually different continents. As a matter of fact, actually, we had quite a variety of locations from where people came from to see us. But you don't always have to see us in person. We can always connect with you via telephone, get things started, or Skype or otherwise. Do you want that information or contact?
I can find that. But what would I do if I wanted to have like the IV vitamin C? Where would I go?
Well, there's only one place you'll get that, and that is from a holistic physician, right? Not available.
Right. So
the regular physician will not do it.
Yeah. So but if you're interested in a consultation and just basically getting your life optimized in other ways, of course we can do IVs over a long distance. That's one thing we cannot do, but we can certainly talk about everything else.
Right. So an acupuncturist or something, they wouldn't give IV vitamin C or?
Not
no.
Well,
acupuncturists generally cannot do.
Usually not. It depends on each state and what's allowed for each specialty. But most specialties it's quite a restricted field.
Okay. All right. Wish there were more around.
So do we. Yeah.
Yeah. Okay. Thank you so much.
You're
Blessings.
welcome. 417-447-1777. Now the time. Ask us a question right now.
And until we have a caller, so we started talking about the body being electromagnetic, including every cell, communications between cells, nerves, neurons, but also just everything in the body, from the heart, from cardiac rhythm, and to the brain. And and there's harmful and there's helpful things that are on that electromagnetic range. The harmful things, and if you can stay away from them as much as possible, of course, television. Television is terrible in more ways than just electromagnetic. It's just terrible. Period. I'm just going to stop there because, what's coming through there, I should say.
One of those obnoxious creations in history.
Exactly. If a person wants to listen, they can. I'm not going to tell them what to do or not to do, but I refuse. I literally refuse. But there's also positive and helpful electromagnetic support, which is and one of the best things is a pulsed electromagnetic field, especially if you can support the brain and the nervous system. And so for that purpose, we do recommend a good device that will do that. And that's a PEMF unit that can help the brain and the rest of the body, literally.
And the gamma PEMF is the only one that we know that puts the brain into gamma. And gamma is in the zone. Woo!
Feeling good. Absolutely.
First described in Buddhist monks who meditate 8 hours a day. Now you can do it in 30 minutes. The gamma pimp and you don't have to meditate 8 hours a day. And it is the greatest in curing anxiety, depression, local pain, etc., etc., etc.
And until we have a caller, I do want to make a point, and we'll say it again if we have time towards the end. The most important thing, as we started talking in the beginning of the radio segment, make a decision, make a choice, choose a direction. Are you going to allow yourself to fall into the clutches of the conventional medical system, including, as we talked about, the third-party rape, the insurance issues, and hospital and organizational medicine? That basically the whole picture is just it's scary. It's very scary in many ways. Or will you choose health, wellness, and to take care of yourself? And there's only one person that's gonna take care of you, and that's you. But you got to make a decision.
Now, the important thing is choose health. And it's very simple. Yes. I mean, I consider my health routine one of the simplest and safest things in the world. And I've done it for, most of my 88 years. I don't know when I took over, but not later than age 12. And I had a wonderful family, and I was encouraged to do this kind of stuff, but I was the one who did it.
Perfect. You made a decision. Yeah.
And, of course, do get and practice autogenic training. I cannot overemphasize the necessity of training your brain so that you can detach from those things you cannot change.
Mm-hmm.
Autodidact training is my favorite. I trained my brain only in 1972, but I even spent 3 years getting a PhD in psychology just so I could understand this whole concept of self-regulation, self-control. And it's a wonderful concept to be in charge of yourself.
Wonderful. The whole idea of environment controlling you versus you reacting, not in other words, not necessarily reacting, acting appropriately in what is your best interest to whatever's coming in from the environment. That's the difference between having the choice, the power, the freedom. Health freedom is one of the best and most essential things that we have, and I certainly hope we retain it.
I hope it continues. Now,
Yeah.
should we look and see if there's any more questions? Oh, you still can't get them.
Yeah, our signal's improved quite a bit. So the second half of the show, they've been able to hear a lot better.
Mm-hmm.
One question that they had: can people with naturally low blood pressure use the magnesium lotion?
Oh yes, it will not lower your, in a person with normal low blood pressure. It won't lower the blood pressure, to my knowledge.
And is tryptophan the same thing as 5-HTP?
No.
5-HTP
is a variation of tryptophan. I actually prefer tryptophan itself to 5-HTP, and I do recommend it for people with depression, especially
in combination with homeopathic doses of lithium orotate and taurine. By the way.
Well, but actually, you don't need the taurine most of the time unless you've got agitation as well.
Well, yeah.
By the way, this time, okay.
Good
afternoon. You're on the air.
Yep. Hi.
Hi. What would you suggest for if you're right on the edge of hypothyroidism?
I would suggest two things. A little bit. First of all, at the top of my list is no fluoridated water.
Okay.
Fluoride poisons your thyroid.
Okay.
Number two, you must take a little bit of iodine. I like etomidine or iodoral. Iodoral, one a week.
Yeah.
Could you spell that for me? I'm sorry.
IODORADOL, 1 tablet a week.
1 tablet a week. Okay.
And next, Fire Bliss, that you'll have to get from us. But if you apply that for a month or two, the chances are great with the iodine that it can help you restore your thyroid.
And if you still have, by the way, the best way to check to test for thyroid, and because of fluoride, the tests are quite deceiving. In other words, you can get a normal test but still feel terrible and have abnormal function.
Yes.
So how do you really test?
Oral temperature when you've been out of bed 2 or more hours.
That's it.
You want it at 98.6. And I actually saw somebody today with 98.7.
Oh, okay. No, that's the first that I've seen.
First I've seen in a long time.
Yeah. And then, of course, if that's the case, and if what we suggested doesn't resolve the situation, or you're still not feeling well, hair, nails, other issues, or energy, mood, there's so much stuff there that goes with thyroid. It's a master hormone. Then you may want to reach out, and there's options in terms of certain prescriptions, such as Armor Thyroid, which is somehow, for some reason, conventional medicine is just not able to do it.
They only use pseudo artificial thyroid, and it works about 10% of the time, whereas Armor's works at 90% of the time.
Yeah.
Okay, and can I ask one quick question about that?
Sure.
Is if that comes to be after trying the iodine, etc., can you get a prescription from you?
Yes,
from
do it frequently.
Okay.
Yes, we can have a consultation on the phone and prescribe it to you for the rest of your life.
Okay, so a consultation on the phone would be fine for that then.
Yes.
Okay. Thank you so much. I appreciate that.
Thank you.
Have a great day.
Blessings.
Yes. And folks, it's time for one more call, perhaps, but we are still here next week, although. And in the meantime, of course, go to Real, REAL, Holistic, HOLISTIC, DOC.com. You can find your answer to many questions right there on our website. And of course, if you really do want to talk with us personally, then set up an appointment, 417-351-5221. It's worth it. I would say that at least half of our consultations now are by phone or Zoom.
I would say more than half.
Yeah.
Yeah. Mm-hmm.
And it's worth it. I mean, I'm amazed at how well it works. It almost all ages. I mean, do lots of consultations with children, even over the phone.
Yep.
But with the parents there, of course.
Well, the good thing about telephone and Skype is now people anywhere can call in, so or can get in touch.
But until you are set in your own health habits, please get and practice autogenic training. I cannot overemphasize that, how important in this time of generalized stress throughout the world, how important autogenic training is to your well-being for the rest of your life.
Absolutely. And as we said, I did want to actually, there's Toastmasters, I think I remember, Brains are Wonderful When They Work. There's a wonderful concept. At the end, always summarize the main concept. And the main concept is choose health.
Well, it's a nice choice, and it's an essential choice, in my opinion. And if you need it, well, then go for it. Now, the important thing is you can take control of your own life, and I hope you will do so. Do you know if he's ever gotten my book, 90 Days of Self-Help, back online?
Actually, there's another book which is actually wonderful, which is utilized, which is Common Sense. Restoring Common Sense. So that's a download, and it's a book that was written, as a matter of fact, with a health and wellness in mind, but with a general common sense. So it's not just medical; it applies to many aspects of life. So yes, and that's available. Yeah.
Okay, I want to be sure that you get what you need, and of course, the most important thing is your supplements and the autogenic training. They are at the top of my list for everybody in the world. Now, the important thing also is think. Every thought is a prayer. Thinking sets in motion spiritual forces to bring about change in body, mind, companions, hope, despair. It is how you, organize your life. And if you have a problem, then think and solve it. And that's where autogenic training will teach you what to do and how to do it well. It is critically important to everyone. I think it should be taught at kindergarten age. Interestingly, I have a telephone radio call-in show every Thursday afternoon at 4 o'clock. There's a woman in New York who's teaching her 5 and 6 year olds autogenic training and loving it.
Wonderful.
And I think it should be taught to all children in all ages. And of course, think peace. Nothing is more important than being at peace. Every thought is a prayer, but think and feel peace every moment of every day. And until next Thursday at 3 p.m. Central Time, y'all have a good one.
And the official radio time is over. I guess this is it. We've pretty much said what we wanted to say. If you have any questions, get in touch with us. Our website is full of information, realholisticdoc.com. But also the clinic at 417-351-5221. And everything is about health. Everything is about your best life. So once you make a decision that that's what you want, it's time to take action in whichever way is best for you. Take care, and we'll see you